We talk very much about everybody being a leader here at NHFT, and there's no more important job than keeping everyone safe.
So I'm really pleased that the Trust has got the Keeping Everyone Safe Week, because it just sends a message that we need to be thinking about quality and safety in everything we do.
We started the week, I think we had over 100 people in the room joining us to start the conversation across the Trust.
You just have to look at the stands and the stalls out there, but also the dedicated, motivated people that are manning those stands to see the great stuff we're already doing.
I was reminded about how difficult. One of the reasons I came up today is because I really admire the work you're doing, which is shifting from telling people they need to kind of make a safer environment to actually experimenting with how to do it. One of the next things that can happen is you step into somebody else's space and they start to use their positional or coercive power to get you to go away again. The kinds of conversations people feel able to have makes a huge difference in keeping people safer. And the reason it makes a big difference is people feel free to speak to what they notice. They don't go quiet, they don't go private, they don't go silent. They feel free enough to say, this is what I'm noticing, I'm not sure about it. And for people around them to say, wow, that's really interesting.
The only people that stop people from speaking is themselves.
Feeling safe is that I can say things within the team, within the staff side, and not be judged, and feel that my contribution has been valued.
If we don't talk to each other, then that results potentially in them feeling very unhappy at work, which then leads to patient experience being poor.
I hear patients say, well, you're the first person who actually listened to what I had to say. And without listening, you can't find a diagnosis. Without a diagnosis, you don't know what's going on. And if you don't know what's going on, you don't know what treatment the patient needs.
How many of you look at data at work? One of the sessions I've done over the last two conferences is around the value of data.
So I want to start with run chart.
And in true NHFT style, we've enjoyed making paper aeroplanes. What we got people to do was fly their planes. We measured the length, and then we got them to do a standardised plane, and we measured the length again. And we plotted the data to show how that data can make a difference and use that for quality improvement.
Our new approach to dealing with difficult misconduct cases.
We've had a great week, lots of different speakers, talked about culture, the importance of leadership, the importance of well-being.
Then he'd drive me back to school and it would just be back to hell again.
I took a lot from people who shared their stories, whether it's from bullying, mental health, that really have given them a power of sharing that across the organisation and how safety's made a difference to them.
The first time in 20 years, it's like this little fire had been lit. I'm quite widely known for the guy that ran 401 marathons in 401 days. It stopped becoming a physical task and started becoming more about this. I think a lot of people know about what it was that I did, but what they don't understand is the context behind it.
As a child in a boarding school, he should have felt safe in his bedroom, he should have his own place of safety. Well, he was bullied even on his bed.
It affected my confidence and self-esteem right the way through my kind of teenage years and into my 20s. And it was through running that I kind of found myself again.
He's used something that really means something to him in his life to make him feel safe.
We changed the lives of thousands of people. We raised the issues of bullying and sexuality.
What an amazing man, very inspirational. I couldn't help thinking, how the hell did he do that with a broken back?
My big passion is I think that service organisations begin and end with the people.
We were really delighted to welcome Dido Harding. I think she recognised the fact that by being here today, we were actually driving further towards more improvement.
What makes for the safest healthcare organisations in the world? It's about a fair and just culture that really allows people to do their best work. It's about the people. It's about creating an environment where staff, service users, all stakeholders feel that they can speak up and say when they feel unsafe, say when they've got a great new idea, and work together to do what's right.
This afternoon was really powerful. We had Johnny and Neil come and talk about Johnny's experience with his mental health.
I remember something in my head just kind of literally snapped. And I just said to myself, I can't do this anymore. It was unbearable.
Neil was walking past on his way to work, and how he saw this man sitting on the edge of the bridge
I didn't know it was a suicide attempt. It was just reaching out to say, "Hi mate, how you doing?" And that's how we first met.
We just had this conversation, and it was just a conversation, but it was, it just changed everything.
Something very simple is, are you okay? You will be fine. Some reassurance.
Someone was finally there to listen, like really listen. I hadn't been listened to like that before.
I think the public need to shift to start to talk about mental health issues. So it was a great presentation.
On your tables, we've got a mind map.
I think the energy that we've had across the week has been the most amazing thing. Everybody talked, everybody created new conversations, and there was lots of new ideas about how we could even go further to strive towards being outstanding for safety too. A real ambition, not about a rating, but about the importance of safety at the heart of everything that we do at this trust.